Welcome, everyone, to the healthcare panel discussion. Our moderator today is Victoria Smith, or Vix, joined by our valued customers Kevin Spallini and Walter Dobbins, and Austin Paramore from Baxter.
Morning, everybody. How are we all this morning? Not too tired, I hope. So we are here with a very respected panel, in my opinion, and hopefully yours, to discuss what we're finding in healthcare currently. So I should probably introduce myself for those of you who don't know me. My name is Vix, as Kelly said, and I look after healthcare for everywhere that is not in the US. Just an internal joke there, guys. Our team helps to secure and manage devices within healthcare settings, and we're really fortunate that we get to work globally and see the differences that are happening. And I have previous experience within the NHS and have been there for a really, really long time. So, welcome to our JNUC panel discussion this morning, and I am going to introduce you to our panelists. So, gentlemen.
I'm Kevin Spallini. Is it me? I'm Kevin. No, Walter.
It's Walter first.
It should have been me. I should have been first.
Yo, no, C comes before you. So I'm Walter Dobbins. I'm from Cincinnati Children's Hospital, and we're happy to be here.
Kevin Spallini from UCSF. I'm Director for Clinical Communication. So my team has phones, communication software, Jamf, pagers, connects all, and a host of other things.
And Austin Paramore, originally with Volt from a care communication perspective, but through acquisitions, now part of Hillrom and then Baxter. And I cover strategic alliances for Western Europe. And I'm also our Volt product owner for Western Europe.
Thank you, gentlemen. So there is a saying, I believe, that there is 6 degrees of separation between us all at some point. However, I have recently found out that it's not quite so distant with these guys. I'm really lucky that I get to work with Austin globally. But gentlemen, could you possibly enlighten us a little how you all know each other?
I mean, I could start. I will tell you that I don't think I've seen Kevin in person for at least a few years, and I moved all the way to London, and somehow I'm right here back with you on a stage.
I'll take that one. Yeah. That's my fault.
But really, both of these organizations helped us to introduce, mobile devices, smartphones, into hospitals in the very early stages as some of our first children's hospitals to deploy these. Cincinnati Children's going just after Texas Children's, and then UCSF putting it in their brand new hospital is kind of a greenfield. So we've got a long history of working together and working through all the early challenges of mobile device management and charging solutions and all of those things.
We call it fun.
Yeah. It's fun. It's fun. It's like hazing. Yeah. Kevin, anything? I know that Kevin...
Austin was my first sales guy, and the joke was he was the best and worst salesman I've ever met in my life because he didn't actually come from sales, so he actually told you the truth, which made him great and bad all at the same time.
And then he told my boss that, and
I did.
I don't know if that went well.
And then, I think it's with like Walter and these other groups, we end up crossing paths at so many of these things and, talking on so many calls over the years, and some amazing insights in working together and realizing, if I have a problem, I can reach out to this network of folks, and somebody's dealt with it, thought about it, worked on it, and I'm not alone in this, so we can draw from that wealth of knowledge from kind of all aspects.
I think we're all lucky in that respect because I get all of you on tap when I need support, which is great. And in turn, it's that better together story that we were discussing yesterday that it absolutely means the world to people when somebody's experienced something and you have those relationships that you can draw on. It does make a massive difference, especially within healthcare.
I think it's an and story.
It's a what?
And.
Oh, and stop.
See?
That.
I think it's the official
I
Jamf
didn't prep
drinking
him for
game, to be
this.
honest with you. Every time you're and you got to take a shot.
You get your drinks tonight.
Yeah.
I didn't even prep him. That's amazing. Can we have a little round of applause for that? I feel that was well deserved. Well done, Kev.
I was promised a gift certificate every time I say and.
That's also not true. So anyway, now you all know how we know each other. Let's talk about how we work with our partners across the globe. So obviously, I've asked for Austin to join me from Baxter. So maybe it would be a good time for us to have a little conversation about what you can do and how you can help us, and again, what you've helped the boys with.
Yeah, no problem. So Vix has been kind enough, as I've moved over to London, to introduce me to all of the right folks. And I think, a big part of, being able to deliver solutions that are going to help your organization is having the right combination of partners that are going to work together. So that's been really, really helpful. Back here in the U.S., we were talking about how we know each other. They have their secret user groups and things like that that they get into. So if you are a hospital resource over here, that's what you want to get into with these
like
guys.
therapy session.
But it's been amazing to be able to partner with Jamf and Apple and other folks to be able to bring us to the point that we are today. Because if you look back 15 years ago, I probably shouldn't say this, but you had to jailbreak iPhones to get push notifications to come through, right? Like in the very early days for your third-party apps. And we've come a long way since then. And the way that we can manage devices, make them as touchless as possible, versus back then when I spent probably the better part of 3 years in the Cedars-Sinai EIS department. More time there than I did with my girlfriend, and I'm single now, so imagine how that went. Just trying to update 20 devices at a time and roll them out to hospitals, so yeah.
Thank you, Austin. So let's talk about what's going on for you guys. What are you seeing? What's happening in your world? We're all impacted, obviously, with what's going on globally. We talked yesterday with regards to the nursing shortage that we're all experiencing, and the strikes and the fatigue and the burnout. So if you would be kind enough to share maybe a little of your technology strategy with us, so these guys can learn, and so can I, hopefully, what's going on for you. So Kevin, can we start with you?
Yeah, I think the most exciting thing that I'm really looking forward to is we're working on setting up to move to AirWatch, which I think is going to be a much better solution.
Kevin, I warned you.
Wrong conference? Okay.
I told you I would remove you from the stage and put you in the corner. Yeah.
I guess what we're really working to do is, take a lot of this started in-house for us. So a lot of this started inpatient focused, and really turning this into kind of the whole enterprise. When we first started, we really took a strategy when we deployed in the hospital that everyone was going to have a phone, everyone was going to have the same phone, and everyone was going to be on the same platforms, Volt, whatever it is. And there was a ton of wins there when hospitality through attendings are on the same thing. We went big bang, and I talked to others, and they're starting in a nursing area, they're starting in this area. We really found a lot of value in having everybody on there. We have a hospital we just went live on, and because of funding issues, we weren't able to get hospitality on there. We now have a central command center for throughput to try and increase bed space and increase volume, and we're challenged in that hospital because hospitality is a key part of that throughput formula, and with them being not on the same platform, it's really challenging to communicate with them. And in addition to that, we're really looking at getting providers all in and replacing physical pagers. And this is always the topic that Austin told me 12 years ago he could replace my entire pager system, and he was lying to me. It's not true. And everyone always laughs, "Oh, you're still on pagers? That's ridiculous." But there's so many unique workflows in healthcare that require that pager number. So we're working to replace that physical pager with a virtual endpoint, but everything that goes along with that, and getting all of our providers, in ambulatory And in all these unique places that they're serving, so we're providing services to outlying clinics, we're providing services to rural areas, we're doing San Francisco General, and really being able to take that kind of those solutions that were designed for a hospital or a building and expanding them out and making a menu of things that's the same but different to be able to meet all those different use cases. And then as we do that and as we grow and get out, being able to support those things, because it's one thing when I have a group of field service people in a hospital or I'm contained to a hospital. But as we grow and as we get bigger with this, we need to be better about how we support it and making it easier. We have, the provider's using their personal phone. What happens when they break it or lose it and they're on shift and we got to get them another one? What happens when that happens at home? So that I've been kind of saying, like, how do we operationalize this stuff? Apple and Offshot are gonna love for me to buy a ton of phones. Austin's gonna love for me to buy his app, but at the end of the day, we have to operationalize this whole stack and make it all work together.
Are there any obstacles that you've come across from the workforce? Because I obviously have been in your position when I used to work in the NHS. And now I can probably say this, but you gents can't. But ladies of a certain age don't necessarily take to technology in a particular way. We decided on Apple because of the intuitive way it works. Obviously, it makes absolute sense for us. However, we did still come across obstacles. One lady decided that she didn't know what she wanted to do with it, so put it in her husband's safe. Yes, I mean, that's a really good way to mobilise clinical staff, guys. Yeah. So we did some training and we looked at how we could help these people who were perhaps not quite as technology focused as all of us. So what obstacles have you come across?
I think that we have not seen kind of the technological issues. We hear about that and it's kind of a common story. I don't think that's been as prevalent for us. I think the thing we're coming up against is, especially in our provider, these devices are one of those things, and it's a rare story. Like when we first opened, people were knocking on my door asking for more of this technology. Like most of the technologies we put in, don't get used, don't get leveraged. Why did you do this? The RTLS badges are in the drawer. No one's using them. The workflow's horrific. Yeah. This is one where people were like, we need more of this. So on that front, it's been really successful. I think the spot we're struggling in is as we look at providers, there's a group. We also want to have standardization. So the goal for us has been to have a single communication platform and everyone's on the same platform. So we have not gone the Epic Chat and then a separate VoIP and then a separate paging app. We really wanted that all together. And the challenge has been with some of those providers, they're so used to customization and getting what they want, especially at UCSF, because every provider is a unicorn and the most amazing person in their field, and they're special and they want to be treated special. So,
Just so you know, that's how I feel about you.
Of course. And getting them all on that same thing, right? So getting you have to use your personal phone. Well, I don't want to. And then you have the ones where, okay, here's a work phone. Well, I don't want it. And that's, I think, wrangling those providers and getting them on that consistent platform has probably been the biggest challenge lately.
Thank you. Walter, do you have anything to add?
No, I was just thinking about the providers and the idea of them using their personal phone. It made me think about a situation at my hospital, probably about a couple of weeks ago, where a provider could not get to vote me, and it just wasn't working for her. And it was on her personal phone, and she said, I'm very, very important to the hospital. And I said, I totally get it. I understand that you're important to the hospital, but if your device is not working, I have a device that you can use that I know for a fact that will work. And she was just adamant not wanting to do it. And I said, is it about the babies? Isn't it about the kids? Finally, she said, okay, I'll take the phone. I'm thinking, my gosh, we got the technology here for you. So, no, I just wanted to give that story. But, I mean, for us, at Cincinnati Children's, more than anything, it always has been the patient experience. we're not who we are. We're not a hospital if the patient don't have a good experience, right? And so as much as we focus on the clinical staff, what we used to call the Volt phone, now it's called the clinical smartphone for us because it can do so much more.
Doesn't quite have the same ring, I don't
It does not have the same ring. No, not at all. And we're trying to get people to embrace that. And I think the tech between the iPad that we have in the room and Rover, Epic Rover, those communications can happen between a patient and a family is one of our big goals. We're doing some QR code scanning and some other things at the hospital that will allow that smartphone to be more smart and not just a Volt phone. Yeah, that's all I wanted to add.
I think it's also bringing IT with us on that journey. Like all of our network and wireless infrastructure was configured and set up well before any of this was a reality.
Yeah.
And bringing them to the table and how can we work with what we have and make this work. I think as you were saying that, my team, I get called for the Volt phones are not working or Volt's not working, and the truth is the whole stinking Wi-Fi network's down.
Right.
But the first place they see it, because it's so high impact, is the phone.
Yep.
And when you dig a little deeper, you're like, well, none of the computers are working either. But like, why is it on me? And we're like such a high touch, important system.
Do you work for Cincinnati Children's?
No, it's a common story.
That literally happened like last week.
I had the same thing last week. The whole damn network was down,
Yeah.
and they were telling me that Volt was the problem. And having those partnerships and getting that infrastructure to support these things that haven't been around.
Do you always find that it's just as it's going out of hours as well? Because that was always a favorite. Friday afternoon, something would happen, network outage would happen on a Friday, and then everybody would like brace for the weekend. But it's about making sure that we have the tools that we need. I echo it many, many times a day. It's about having access to the right tools at the right time. And I guess, Austin, you see that on the other side.
I do, and I mean, it truly is a partnership if you're working with the right group of partners, and you really have to meet halfway. The biggest challenge that I see from the vendor side is we need to bring you robust solutions that have a lot of capabilities. We need to bring you the right mix of partners that are going to be able to deliver a complete solution. But then you can't try to solve people problems with technology, right? And I think that's the biggest thing that we run into is there has to be a willingness to adapt to leverage the capabilities of all these technologies that you're putting in. So, that typically starts at the top with, strong sponsorship from both an IT and kind of a clinical leadership side, and then making sure that you have, the right pieces in place to manage that stuff going forward.
If I can add just that
Yeah.
to one thing that I noticed in healthcare since I've been in healthcare is, Austin, I like you a lot. Sticking with
Lay it on.
No, sticking with the same partners. It doesn't matter if it's software or if it's hardware. I know for me here at Cincinnati Children's, I've been real focused, like to see the partners in healthcare, right? But don't be so tunnel visioned that I'm only going to stay there, right? And so we've found some success thinking outside of that healthcare box. What can this vendor or what can this software product provide to us that can really connect those dots? I think that's very, very important to understand that one solution don't fit everyone, right? And so you have to be kind of creative and unique in your areas to see like, okay, I understand our infrastructure. I understand this, I understand that. Okay, Austin, you're not the right partner for me in this retrospect, but maybe this one makes sense. Because at the end of the day, we're healthcare. We're taking care of that patient in that room, and that's the priority.
I mean, it's why we all do what we do, isn't
Absolutely.
it?
Saving babies.
I came to work at Jamf because I could see that I was going to be able to still make a difference, whereas it's limited in the NHS, as I'm sure you're all aware. It's a publicly funded organisation. So I think for you guys, my learning experience is watching what you do and then being able to replicate that globally. It makes a massive impact when I can say, I have these guys in the US that are already doing it. They've been through the pitfalls. So what does the future look like? Let's pick a dream and go with it. What could we do to make it better? What would be everything you would want it to be?
Single sign-on, did you say?
Oh, wait, we're going to do single sign-on?
We haven't got to that slide yet.
Oh, okay. Sorry. I just got so excited. I'm sorry.
Yeah.
I think it's amazing how at times difficult it can be to do the simplest things with what we have. And like the example that we've talked about a lot amongst us is scanning QR codes. So on our phones, we've locked down the camera roll, shared devices, nothing stored on the device, which then means the native Apple QR code scanner doesn't work because you took away the camera roll, which disables the native camera. And everybody, like nursing education, videos, like everyone's like, oh, let's just scan a QR code. It sounds so simple. And I'm over here beating my head against the wall because it's simple. It should be easy, but it's not. And all the free apps you find are like, I'm like, I can't log into anything. I don't want ads. I don't want crap. I don't want it to save anything. And so this was like a year and a half of my life trying to figure this out. And one day I'm on a call with Walter, and he's going through what he's like, oh yeah, we got this QR code app from this company, and they built us a custom app. And I was like, excuse me? You did what? And I'm immediately calling him like, what in the world did you do? And so it was to that point of like, these devices are consumer devices. Let's be super clear, and that's Apple's true focus. I think the thing we found, to Austin's point about pulling IT and users together, when we went out and talked to our user base, we really understood they wanted a consumer-style experience at work, like full stop. And to be able to do that, it takes that work. And I've heard it a couple times here, I think in the keynote, like how do we provide that consumer-style experience at work, but still making it safe, secure, and all of those things? So, that story of there's that piece of Walter figured it out, we learned from it. It should be simple, but it's not. And how do we operationalize all of these things to make it work?
So in essence, what you're saying is that it's better together.
It is.
Okay.
Yeah.
Just to reiterate, in case you haven't got the message.
It's a me and Walter story.
I love that. I love that. And I think that's the thing. We have a communication team that opens up those channels. We have a network where we can share that information. Especially across healthcare, nobody ever wants to do something first in case they get it wrong. It's always really nice to find when somebody else has done it first and they have experienced what you need to do. So having a network to be able to discuss that is absolutely paramount to success, I feel.
Yeah. You know what? I didn't never tell Kevin this, but
there's a lot we don't tell Kevin.
We literally researched the QR stuff for 3 years. So it took us that amount of time to try to figure out how can we get this going in the right direction. So when I called you and said, oh yeah, we're doing QR code, it wasn't as simple as just
You made it sound like you found it yesterday.
No, it was so funny. And we had our leadership kept coming to us saying we got to figure this out. And we used the QR code the biggest focus was education for the nursing. They're always on the floor, and to make sure that they're up to date with their tech or their training, they wanted to be able to scan. And again, it sounds so simple, but it literally took us 3 years to figure out how to take a phone and scan it. Because there's the security behind it and making sure that this device is as secure and restricted as possible. We want to make sure that whatever they're scanning is protected. So everyone we had come to the table, it was a big challenge.
So what you're saying, Walter, is that you managed to cut Kevin's pain in half.
I did. That's
like
exactly
literally half.
I wanted to say I took all the pain and suffering, and
so I owe you one.
Yeah.
Okay, we all have witness to that. Kevin. Anyway, moving on. So. As you said earlier, Kevin, you tend to go for a big bang rollout situation. Now, I didn't. We did it unit by unit. We did it discipline by discipline to try and negate the pressures that we were already experiencing. So, as we know, Kevin likes a big bang approach, but Walter, how about you?
Yeah, I'm with you, Vix.
Yeah.
The big bang, especially as the organization continues to grow, we don't have enough support if something was to go bad, right? So even for our QR project that we just deployed, We are very unique to try it in 1 or 2 units, see if it makes sense, make sure that it's working as expected. And then right before I came to Texas, we deployed to the masses, right? So I am really big on not the big bang approach, but a little at a time. Let's learn from it. Let's see what we can tweak, right? And then bring it to the masses.
I think you're right. Austin, what do you see? Because obviously you see this globally.
I'll go middle of the road because, I mean, obviously we've dealt with all of them. A lot of times, as a vendor, it's sort of dictated by the organization we're working with and what they're comfortable with. But I do think it's our responsibility to sort of bring, best practice, what's worked, connect you with the folks that have done this before to say which way it goes. So I would say it really is dependent on the technology. When you mentioned the QR code thing, for sure you can roll that out unit by unit. But I'm sure Kevin would say if you're looking at unified communication, on a smartphone wrapped in mobile device management and all of those things, like Big Bang is what's going to drive your adoption, right? Because everybody is able to reach everybody on the same platform instead of having to decide, hey, if I'm going to reach out to this area, then I need to use this app or this phone or this pager. And if I'm going to reach out to this area, then I need to go to this solution, right? So really depends on what you're looking at. And I would say for like those kind of what I call unifying and sort of foundational technologies, right? I very much err on the side of small proof of concept, right? Make sure that you've got all the kinks worked out. Right. And obviously scaling still has its risks, right? When you go big bang. But you try to mitigate as much risk as possible, and then going big bang with that type of solution, tends to be the way that we've been able to drive the best adoption. But then again, I've gone to an account where we spent a year and a half rolling out unit by unit, even with unified comms, and managed to accomplish it there. That had a layer of alarm management within it as well. So it was a lot, right, to do all at once. But yeah, both ways can work. And when you think about driving that adoption, for me, it's always about, you think you understand what your problems are at different levels of the organization, but typically you're actually, whether you're at the IT level and you think you know what's going on with the clinical staff, if you're at a leadership level and you think you know what's going on the ground floor, the biggest thing for driving adoption for us has been making sure that we go in and we understand all of those challenges and problems down to kind of the pathway mapping and all of the technologies that you currently have in your organization. And it sounds weird coming from a vendor because that means a longer sales cycle, but there's
sales guy.
Yeah, I know, terrible sales guy, right? But if you do that at the beginning, then you're beginning to start that adoption process. And then the other half of that, I feel, is forming the right governance structure. I talked about that, sort of adapting to the technologies and stuff, because enterprise solutions require enterprise strategy, governance, support, all of those things. And typically you're not necessarily built like that at the beginning, right? So your vendor can maybe help augment that support for some time and augment that functionality, but eventually you've got to have kind of the technology committees in place with representation from all departments, and make your staff part of the process. And if you do that, I feel like we've been very successful in driving adoption.
When we went from our MC40s to the iPhone 8, I believe, I felt like I was a star going out to the clinical units and taking that MC40, which was a terrible device. I literally spent hours on a day pulling those batteries on the back to replace those batteries. Like, all the tickets that I got was 100% about that battery. But
got scars.
Oh, yeah, I still got scars.
Oh, our staff literally have scars because they cut their faces.
I knew I shouldn't have said that.
Yeah, but when I walked out to that floor with the iPhone 8, and then go back to the point that Kevin said, like, the clinical staff wants a device that they're familiar with, a device that they use outside of work, at work. Oh my gosh, I felt like a king walking through the hallway, giving them these new phones, and they love them today, and just the infrastructure and what Apple and Jamf and Cisco and other partners have done to make sure that device is more secure and more reliable. Now Volt is becoming, we can't live without it for 5 minutes. If that system goes down for 5 minutes, it's a major deal because we're doing voice, we're doing text, and we silence patient alarms in the room. And so those alarms are going through Connexall to Volt. And so it becomes a critical platform and workflow for our hospital.
And I think it's the constant improvement cycle on that. You know, like Walter, you talk about deploying phones. Like we did the same thing, and we had a Mophie battery pack on it.
Yeah.
And then, you know, everyone was like, I don't like the Mophie battery pack. And we didn't like them either. Like, I didn't like them. So, you know, we eventually went to no battery pack. I think we were probably one of the first out of the group I know to say, get rid of Mophie. I don't want to see another one of those.
And it helped that the iPhone got so much better with battery.
Right, the
pack and all
iPhone
of
got
those
better
things,
with
right?
battery,
Like, it's an
and
evolution.
then, you know,
Yeah.
and taking advantage of that evolution, right? Like when it got there, and then just putting MagSafe chargers at every single computer we have. And, you know, it's one of those stories like you get from the IT folks like, well, aren't you going to lose those? Yeah, like, yes, someone's going to take one home. Like but the reward is worth that. And, you know, going from the MC40 to the, you know, iPhone with the battery pack that weighed exactly the same, but everyone liked it better, and then ditching the battery pack altogether to get them closer to that consumer experience. And, you know, there's a lot of this, oh, well, are they going to last it through the shift with their battery? And my example is like, I carry a phone 24/7 and manage to keep it charged all day long, and
With a
so
lot of
does
apps
everyone
on it.
else. And, you know, it seems reasonable that you could expect someone to do the same thing at home in their personal life, and we haven't had a single problem with it.
I think you're all absolutely bang on with everything that you're saying. So at some point, somebody has to accept responsibility for looking after it, you know, and we all want somebody else to look after everything else for us. I think from the adoption that we saw in the UK, I think it was very easy to see that as soon as somebody can see what that benefit's going to bring, it's just so impactful. And yet you feel like you are on top of the world, making their life simpler. Yeah. And I think, you know, it echoes what we talk about all of the time. It's about making sure that the right tools at the right time, at the right place, to make sure that we understand what our clinical staff are going through. There's always going to be some sort of disparity between IT and clinical staff, because that's why we have us all, because we all think slightly differently. But it's about making sure that we find that common ground. Thank you, guys. So, Kevin, I think this is over to you.
Yeah, I think we talked about scanning. We worked it in.
We did it already.
We worked it in.
I feel really proud of you guys. I'm so happy.
It's like we've done this before.
No way. So, thank you for sharing. I do appreciate it. It's really important that we can understand your successes and your scars, saving him loads and loads of time. Let's be honest, a year and a half
You're
is...
welcome. You're welcome.
So drinks will be on Kevin later, if
I'll send
anybody
you a
needs it.
Thunderbolt in the mail.
It's always invaluable to share this sort of information with each other, you know, to make sure that we can go on a journey together. The thing that I think I would recommend from Jamf's perspective is to talk to each other, to make sure that you have that network. It is really important, and I see it globally, that it makes sense. You know, we don't want to reinvent the wheel every single time. We want to make sure that we're building on what we already have. So, can you tell me what's next? Dun, dun, dun. Walter, I think you're up first, darling.
Yeah, for us, is hopefully we want to really mature and embrace single sign-on. As we talk about the clinical fatigue, and this phone is not just a Volt phone anymore, it's a clinical smartphone for us, and we got multiple different apps. We see that our nursing staff, they don't want to sign into different apps individually. And so single sign-on and something like that will allow our patients to be more cared for by our clinical staff, because now the clinical staff is a little bit happier. They can sign in one time and then sign out. I think that's a big win for us. So, yeah.
I think it echoes again. It's definitely about making sure we give that clinical time that they're needed. You know, I remember a nurse throwing a laptop across a room because she couldn't access the EPR system. And I was like, what are you doing? Well, I mean,
Right.
Come on, you know, you've got to provide this information, because people need to be able to care for that patient when you're not on shift.
And I've always tell some folks that I work with all the time is that we were hired for the tech, right? And so it's not important for our nurses and our clinical staff to have to understand the tech to figure it out. We figure it out and we make it as simple as possible for them, so then they can focus on why they got hired to care for that patient, right? So it's very, very important to us.
Thank you, Walter. Kevin?
I think for me, it's an and story.
I feel so proud of you today.
Right? I'm historically very hard on vendors. I know this is probably hard to believe.
No.
Yep.
Oh my God, this is new information.
And I think Jamf has been a great one to work with.
Absolutely.
For sure. And this is one of those stories where, Adam and Tim and Chris and Bree, and we sit together and, they're really intent on understanding what our issues are and where we're struggling. And, we're intent on how do we leverage the technology and the operationalizing this in the best way possible. And, as we're looking to expand and make this better, one of the things we kept coming across was we need to be able to empower the user on the front line to do more. So, keeping track of our phones is a challenge. We're locking them in the background, telling them to get back to the unit, which works great. And, to your point, I had to be the one to say, lock the phone. Like, if it's in the wrong spot, lock it. I don't care. But then once it gets back, they got to call us and we have to unlock it. And so, now in this point, we have downtime on that device that's so critical to us. And as we explained that challenge, and then, as we're looking at iPads, they're assigned to a room. We got into the challenge of, well, what do we do when we need a loaner, right? The device goes down, something happens, it's Friday at 2 o'clock in the morning, and we're not coming back till Sunday or Monday morning.
Yeah.
How do we get a next one in there to get that patient going again? But okay, well, it's a loaner, and now it's not connected to Healthcare Listener, and it's not going to wipe, and you're going to have to do manual, and it's never going to work. So having those conversations, Adam probably spent a couple late nights bouncing around his house and came back to us with this, hey, we have an idea, it's something that we didn't envision or think of where we articulated the problem, and Jamf came back with, let's give you this QR code scanner app where the user on the unit, your power user, can take action against those devices. And a lot of those use cases that Adam's referring to are things we talked through. The patient locks the iPad with a PIN code and leaves, and for whatever reason ADT doesn't work. We're out of commission. Scan it, reset it. The nurse goes home without logging out of their phone. We're stuck. You got to call us, unlock it. Give them the ability to scan it and reset it. We've lost a phone, we put it in lost mode, it makes it back to the right spot. Instead of putting a ticket in and waiting for us, scan it and reset it. So making those operational use cases easier, making the end user more empowered to take action, and not having to wait on us in the background to do those things to get those devices in the hands of providers caring for babies.
I feel like I couldn't have said it better myself.
And I would just say, well, a tall order, but Vix and I are going to take over Europe and beyond. But I do think that what's next...
Not all of EMEA?
EMEA, okay. Yes, you've learned the term now.
I got it.
Basically not the US.
Yeah, not the US. But I think, for us, it's less about necessarily the technology and sort of more about, being able to form some global user groups, communities of practice, things like that, to be able to share information. Because while we've gone through a lot of that technology adoption over here in the US, and maybe they're at the start of their journey in Europe, there's also things that we could learn over here when you think about an organization over there has maybe 2 or 3 IT staff compared to 40 or so over here, right? So you talk about being able to operate lean and with sort of touchless capabilities and all of that stuff, and being able to manage these devices very easily. You don't have the staff to go around and do rolling upgrades and, manage all of these things. So I think that there's a lot that we can learn, from both sides. And
the van is going to Europe.
Exactly. Hey,
the van's going to Europe.
It's
yeah,
out
you
there.
can come.
It's
It's fine. It's okay.
Yeah.
I've cleared it with the rest of the team. They're coming too. Guys, I'd like to thank you very much for your time today. I absolutely appreciate Kevin behaving mostly. But I appreciate your time, your wisdom, and sharing everything that you have been through. I can't wait until next year when we get to talk again about what we've achieved in the last 12 months. So thank you, gentlemen. I really do appreciate it. Now, we do have a very exciting session that you can go to, and I want to say it's in room 14, and I'm looking at somebody to nod and agree. Yes, they're nodding and agreeing. Room 14 is where you want to be. If you have time in your agenda, it is definitely worth a visit. You will experience the wonderful team behind what's going on. So with that, I'm going to hand the microphone over to my wonderful colleague, Kelly, for any questions, and hopefully the gentleman will answer it for you.
Wonderful discussion, everyone. We've got multiple questions. We'll see how many we can get through. All right, so how do you deal with broken shared devices? Do you centrally fund replacements or charge departments? If charging departments, how do you assign cost of replacement when nobody admits to causing the damage?
I can jump in there.
You want to start?
We provide the device to them initially, right? And then we have compliance policies to say, like, hey, this device has to be checking in to Jamf every 5 days. And if after 5 days, we'll give you a little bit more leeway. After 30 days, we're charging your department.
Nice.
And I think the model we've taken, which is a little different, is we lease all of our devices, which was, I think, a great decision because it turns it into an operational cost instead of a capital cost. So, when we start to look at replacement and refreshes, we don't have to go after capital to replace our devices. We're on a lease. We can stay up to date and have, as current of the technology as we need. And that's all funded by me. So my cost center bears the burden for every single lease across UCSF. And in that event that they lose a phone, because they're leased, we have a contract with a repair company approved by Apple. So we're constantly sending those phones in and out for repair as needed. And for those groups that do lose phones, with our leasing, we do have a forgiveness on that lease. So we definitely take advantage of that. If a department loses more than X% of their phones, we do charge them. I think, unfortunately, given kind of the fiscal structure of large organizations, that's probably not the hugest deterrent in the world. So we've really taken make it central. It's so much easier for me to own all the iPhones, for me to control the lease, and really looking at it as it's a tool we need. Let's make it happen.
I love that. All right, so how do you keep your devices current on iOS, iPadOS updates? Being in a 24-hour clinical environment, has it made it challenging to process updates without interruptions for the users?
Yes. It's a hospital, so it's a major, major challenge, and we have not figured that out. Hopefully, next year we can have conversations around that. But even with Jamf 11 coming out and the opportunity of software updates to be improved, I'm very, very thrilled about that. We used to wake up in the middle of the night in order to do software updates. To be able to schedule it is going to be huge. My wife and my family is going to be happy to see me a little bit more, hopefully. But yeah, for me, I think that's still a challenge that hopefully we will be able to overcome here soon.
And I think the biggest thing here is being sort of honest up front about the expectations of what you can accomplish. These things are going to happen. I know we would love for it to just be able to be all pushed over the air and just happen, but these are large files. Wi-Fi networks only have so much capacity. You have to understand the limitations of the technology, and you have to build this into your, downtime procedures, disaster recovery, all of that type of stuff to make sure that you can do it. So I feel like, people become very reliant on these devices, so I totally understand when it goes down. But I would say that with most places, we've been able to get down to a fairly limited interruption.
Absolutely.
Well, and I think that's a push on the vendor side where the answer has often been, oh, just take them down for 4 hours and do it, which is not going to work, right? That's not acceptable.
Yeah.
And helping
The EMRs get away with it though.
push the vendors on it, right? And what we've done is I actually had a staff member write a program and where we can see if the user is using Volt, which is our proxy for them using the device in lieu of single sign-on or logging into Jamf. And then when the user's not logged in, we push for a group of phones the update with the hope that they're not using the device and we can push it there. Once we get through as much of that as we can, then we go back and handle the stragglers individually.
Awesome. Thank you. We're going to sneak in one more question with 1 minute remaining. How do you manage keeping devices charged and ready to use? Our users don't put iPads on their chargers / charging stations at night in our practices.
I don't want to answer that one. Oh, it's still a challenge. I think there's still a constant education and guiding and changing mindsets to understand, like, this is a requirement. In order for it to be ready for you the next day, you have to put it back on the charging station. I still do think that there is some opportunity in the vendor space to improve what the charging capabilities can be.
iPhone 15.
Yeah, iPhone 15. Yeah, but charging at large scale, right? And even though we have MagSafe chargers around to be able to charge, I would love for some of our vendors to really become more creative in charging at scale and wireless charging at scale. I know
Especially for iPads,
yeah,
right? Like wireless charging on
Yeah.
iPads would.
and I know the
help.
tech is there.
Yeah.
We need a true partner to come to the table.
And we've had hospitals actually put the MagSafe and sort of wireless chargers and things like that in central areas, especially for the doctors, so that they can set it down on that when they're coming through and be able to charge it. I would also say, I mean, don't chintz on devices, right? Like, have enough, especially in the shared device models. It's not that much of an additional cost to just have enough that you can be able to sort of swap those out. And then you don't run into situations where you have those downtimes with
It
devices.
sounds like we got our topics for next year.
I feel we have, guys.
Oh, the sales
absolutely.
guy wants me to buy more devices. Shocker.
I don't sell devices.
Guys, it just
Somewhere
leaves,
offshot is very excited.
it just leaves me to say thank you so much for today. I thoroughly enjoyed listening to you guys and appreciate everybody's time. If you need to contact us and the questions and answers that we didn't get to, please contact me via email or any of the healthcare team. Thanks ever so much, everybody. Have a lovely day.